I have here a couple of real brains. On the left is a human brain, and on the right is a sheep brain. My lab is the Autism and Brain Aging Lab, and we're really interested in understanding how aging might affect adults with autism differently. Autism is hallmarked by social communication difficulties, as well as the presence of some type of restricted or repetitive behaviors or interests. By doing our longitudinal study, we can see how those thinking abilities change as people get older every 2 years, and see what parts of the brain people need to recruit more, or what parts of the brain people become less connected to. We were able to find out that this population heavily struggles with anxiety and depression. And from that, we were able to develop a program to offer some stress reduction skills. The future of this research, really why we're collecting all of this brain data, is so that we can maximize quality of life as autistic adults grow older. And we see opportunities here to apply innovative technology to change brain function so that people can think more effectively.
We often will take for granted our ability to effectively move through our environment, walk and stand and transition. But these movements are often very difficult for both older adults and particularly for people who have these neurological conditions like Parkinson's disease, multiple sclerosis. Our work is really focused on understanding balance deficits. It only takes one fall in some cases to lead to a really negative outcome. So understanding the balance deficits that are occurring and trying to improve people's balance is really important to reduce the chances they're going to fall in the future. We use our equipment in the lab to track how people are moving, but particularly track specific aspects of balance. So one example of that is reactive postural control, the movement that a person makes when they feel like they've lost their balance. So if they get bumped into in the hallway, you have to take a step. And so we can identify different techniques to try to keep people from falling in their home environment. An important part of our work is to use things like neuroimaging, structural and functional imaging to see how changes in the brain and specifically identify the specific aspects of brain changes that can result in changes in movement. And so we can leverage that information to further enhance the way in which we design and improve interventions to improve balance, and ultimately improve their independence and their ability to interact with their colleagues and their friends and their family in a safe and confident way.
Every year, over 200 people are rescued on hiking trails in the Phoenix area. These are people that are going out, hike, maybe hike too long, don't bring enough water. And this study was focusing on looking at what people normally bring when they go on a hike without informing them before. So that was giving us a very good idea about how much fluid they brought. This research is innovative because we are looking at hikers in their own habitat. And at the same time, we use tools that people in real life can also use to monitor their own health status. And what we found out is that 60% of the hikers didn't bring enough fluid to compensate their loss. And I think especially when it's very hot, starting after 45 up to 90 minutes, then that may become an issue. Another thing that we found out is that hikers that are not that fit, they spend more time in the heat. They are more exposed, and that means that they are at a higher risk getting rescued. The value of this research is that we can help to guard the health and safety of our community by ensuring that they bring enough water that is tailored for their needs, and that will help to reduce the number of rescues in the Phoenix area.
At the College of Health Solutions, we are improving health outcomes by addressing the systems of health and healthcare, and by optimizing the health and human performance of individuals across the lifespan.
I try to find ways to optimize HPV vaccination as well as cancer screening.
We've done a lot of work focusing on interventions in households to help people reduce their food waste.
We're conducting a study looking at a new naturally occurring substance called cytisinicline and testing whether that substance will help people quit smoking.
Research focuses on underserved youth and family who are at risk for hunger and working within systems to promote access to healthy foods and health equity. So I work with the vulnerable of the vulnerable.
Ultimately, I'm concerned with how we need to design federal policy such that we can improve the health of our population through access and care.
My own research improves health by taking a really deep look at the social determinants of health.
Study bilingual children, and we focus on developing better assessments and interventions for the language skills in bilingual children.
Researching the impact of water intake on health and performance.
And my work focuses on improving mental and physical health in cancer patients and in women's health. And we use complementary approaches for care, so meditation and yoga.
And I study the genetic causes of disorders of speech, language, and reading in children and families. I do this by sequencing and analyzing DNA.
I focus on using wearable devices like Fitbits and smartphone devices that you have on you every day, as well as sit-stand workstations like the one behind me here, to help people live healthier lives.
Improve childhood obesity outcomes at the earliest age by feeding babies' gut microbes all the proper nutrition so that they have a healthy weight throughout life.
My research is improving health by enhancing delivery and therapeutic efficacy of nutrients and bioactive compounds.
And I'm going to tell you a little bit about my research, which is focused on diet strategies to help people manage their health.
That I am most interested in doing is figuring out what are the molecules that are changing in our bodies when we sit for long periods of time. What does that tell us about ways that we can intervene and help the public with these very common practices?
Research interest is to identify biomarkers for many diseases such as breast cancer and Alzheimer's disease.
We translate findings from basic biological research into clinical applications in the area of precision medicine.
My research provides information that could guide interventions that aim to reduce health disparities among underserved populations.
As you can see, we are truly reimagining the future of health. Better health outcomes require better solutions, and with your ideas and support, we can do even more.